Hi, so my name is Pete. I am a no ALL ambassador, and I was diagnosed with ALL in 2013 when I was 18 years old. As many people with ALL, I had 3.5 years of treatment. I'm going to talk to you a little bit about the ways in which you can help with reducing or limiting side effects towards the end of treatment. So at the end of treatment, most people go through what's called a maintenance phase, and that's the longest phase of treatment, but it's the lowest dose of treatment, really. And the important thing from my experience to think about during this phase is how some side effects will get better in time. And, just because you're experiencing something at the start of the maintenance phase doesn't mean that it's going to continue all the way through. And I really think there is a bit of an adjustment period during that time where you kind of need to get to know a new normal for a little bit. But sometimes that can be a couple of months, sometimes that can be a couple of weeks. I did find that side effects and that kind of thing started to improve really quite rapidly, but then there were some which were persistent, some which lasted longer. Um, the thing that I found really quite helpful is avoiding things that make side effects worse. So for me, and I'm sure for a lot of other people with ALL, one of the big side effects is fatigue. And I know once people are on maintenance, there's kind of a bit of a pressure because you're a bit in no man's land of not knowing, um, am I okay? Is am I Can I get back to normal, or shall is this still like it's been for the past few months? Um, so I think there is a danger with some people. They try to run before they can walk. And while I think it's great to kind of challenge yourself, try and push yourself to find out where your limits are because you don't really know them, be careful of pushing yourself too far. And also don't put pressure on yourself because, you are still on treatment, you are still a cancer patient. And really give yourself a bit of a break and a bit of credit for what you're putting yourself through. And don't try to push yourself too much because a lot of the time that can make things worse, especially with things such as fatigue. You know, exerting yourself, trying to rush back to work, that kind of thing can just make things worse. So there's really a nice balance you need to try and find, which is much easier said than done. Absolutely. So one of the things that I personally found in my experience, one of the persistent side effects was nausea and vomiting. And this was something which I was able to control a little bit by making sure that I ate breakfast. That's such a simple thing, but that just goes to show, for one, everybody's different, and everybody will be experiencing different side effects to different intensities. But this is just an example, really, of knowing your body, and finding what works for you. And that was really going to be a lot of trial and error to see what's right. Um, Another thing that I found was I was really struggling all the way through my treatment, as many people do with steroids. I was having a lot of adverse reactions to them. And when I was put on steroids during my maintenance phase, I was finding I wasn't getting on well with them at all. I wasn't sleeping. I was eating way too much. And I was really struggling to integrate myself back into normal life. And while some people, these are not massive things or they won't experience things to such a degree. But I was finding I was in a situation where this was having an impact on my day-to-day life. And I was like, I can't put up with this for nearly 3 years. So what I did was I spoke to my doctor about this. I had a really open and honest conversation. I said, "Look, I'm really struggling with this medication. Is there anything we can do? Because I want what's best for me and what's going to help have my best outcomes in terms of prognosis, in terms of cancer. Um, but is there anything that can be done?" And luckily, they were able to change my course of steroids to a different steroid, which was less invasive, and which I was managing the side effects with a lot more. Having said this, I was luckily I knew, speaking about long-term side effects, luckily I knew about the risk of avascular necrosis from being on steroid use. And after a couple of months into maintenance, I started noticing pains in my ankles, which I knew weren't normal. So again, I went and spoke to my doctor, and I said, look, I'm suffering with this. I'm wondering if it could be due to the steroid use. And they were able to really quickly get me in for an MRI, found out that yes, it was avascular necrosis, and they took me off the steroids. Which of course isn't the best thing in terms of outcome, but is the best thing for me at that time. And really, that's just a point of speaking with your doctor, being open with them, and seeing if there is things that they can change, things that they can advise to help with your side effects and management. Another thing that I found was fatigue and anxiety, as I spoke with before, and it's really important to remember that not every side effect is going to be a physical one. Many cancer patients and ALL patients will experience anxiety, depression, mental health problems, and that is absolutely something which needs to be addressed as well. Um, and I was really struggling with fatigue and anxiety. However, I found for me, and this was something which I learned too late, unfortunately, was that cracking my sleep schedule really, really helped to control that. And I wish I knew that, earlier when I was at the early stages of maintenance, that bad sleep just feeds into this cycle of fatigue, anxiety, that kind of thing. Um, Again, I think that's probably good advice for anyone and will probably help with a multitude of different things. But again, that is knowing your body, and you don't want to be having too little sleep or too much sleep if that's not what your body needs. So yeah, overall, I would say the biggest things to take away with help with managing symptoms, managing side effects would be honest, not only with yourself, but with doctor, with people around you. Be open about your needs and how you can be helped, and ask for advice, especially from medical professionals. Don't try to run before you can walk. Know your limits and don't push yourself at the risk of making anything worse. And that is about it from me.